Hello everyone. My name is Tayeba Naeem. I'm a first-year internal medicine resident at HCA Westside Northwest Hospital's East Florida GME program. I'm here to present a rare and a unique case of recurrent malignant thrombus of the right common iliac vein in a patient with colorectal adenocarcinoma. So what is tumor thrombus or a malignant thrombus? Tumor thrombus or a malignant thrombus is the intravascular extension of a tumor into blood vessels. It is commonly seen in renal cell carcinoma, hepatocellular carcinoma, and the other cancers, but it is rare in colorectal cancer. So let me introduce our patient, who is a 69-year-old male with a history of stage 3 colorectal adenocarcinoma, who completed neoadjuvant chemotherapy and a radiation therapy followed by proctectomy and abdominal and perineal resection 2.5 years ago and failed to follow up afterwards. He presented with a 10-day history of pain and swelling in the right lower extremity to HCA Westside Hospital. 1 month prior to the presentation, he underwent a mechanical thrombectomy for extensive proximal DVT in the right common iliac vein. On this visit, on Doppler venous ultrasound of the right lower extremity revealed DVT within the femoral vein as shown in the figure 1, and on the CT scan of the abdomen and pelvis revealed filling defect within the right external iliac vein. Planned interventions include venogram, mechanical thrombectomy, and stent placement. Interventional radiologists access through right popliteal vein and remove the entire clot from the right common iliac vein, as well as involve tributaries followed by stent placement in the right iliac vein. On histopathology of the removed clot, it confirmed necrotic adenocarcinoma with the primary colon cancer, as shown in the figure 3 and 4. The H&E stain slides showing malignant cells in the glandular formation and dirty necrosis. Further staging indicated progression to the stage 4 disease of the cancer. So as we discussed, venous tumor thrombosis is a rare in colorectal cancer. It indicates the aggressive disease. The involved veins vary with tumor location in the colon. For example, ascending and transverse colon cancers involve the superior mesenteric vein, while the descending sigmoid and rectal cancers affect inferior mesenteric veins. Previous cases have reported tumor thrombus extending into the inferior vena cava and right atrium, as well as diffuse colon cancer invading the portal vein. So how do we diagnose? The accurate detection and assessment of the tumor thrombus can be achieved using contrast-enhanced CT and MRI. PET scans help differentiate malignant from benign thrombus by detecting enhancement, glucose uptake, and vessel expansion, depending upon the specific vessels involved. Conventional angiography, color Doppler ultrasound, and contrast-enhanced ultrasound can also be utilized. So how do we treat this? The primary treatment for the tumor thrombus includes mechanical thrombectomy with adjuvant chemotherapy. Anticoagulation is considered on a case-by-case basis due to bleeding risks. Post-discharge, it is crucial for the patients to follow up with an oncologist. Our patient received 2 cycles of FOLFIRI with bevacizumab and currently receiving the chemotherapy. In conclusion, this rare case highlights the link between the necrotic adenocarcinoma, thrombus in the right common iliac vein, and colorectal cancer. Unlike non-malignant DVT, malignant thrombus requires endovascular removal and chemotherapy. This case underscores the importance of considering malignant venous thrombosis in cancer patients presenting with DVT symptoms. I would like to acknowledge the key references that supported our research, including studies by Tathy Reddy, Otani, and Mears. I would also like to acknowledge my co-authors, Dr. Nang Kam, Dr. Gul Amikweimer, and my attending, Dr. Jason Tashe, for their contribution to this work. Thank you for providing me the opportunity to present this case.